Hey, all you cool cats and kittens. Today we are going to be going over Chapter 8, which is Handling Emergency Situations and Injury Assessment. If you just click on the unit header here, you'll see the PowerPoint for it. Pretty short one here for you, so we'll get right into it. There's a few things we need to consider or look at when we're talking about any sort of emergency situation. Now, when you have any emergency situation in either the school itself, in your apartment complex, in if you're even at home, if you're at work, you should have, and even like say something like the gym or your athletics assembly place, you need to have an emergency action plan in place. Now, you yourself may not have to actually complete one, but you should have this really available or know where this is at so you know what to do in the event of an emergency. For example, if there's a fire in a building, where is my emergency exit? If there is some sort of major injury, what do we do? If there's an active shooter or if we have, severe weather, what do we do? At the Park Gilbert campus, our emergency action plans are actually located at the front desk, and immediately behind that is also where our AED is. Now, when we get on the field, there's a few things to take in mind. If you're doing any sort of on-field assessment, you need to get consent to treat. So this goes into HIPAA laws. It also goes into typically a patient's bill of rights, but HIPAA stands for your Health Insurance Portability and Accountability Act of 1996. It was implemented in the Clinton administration. And what this essentially says is you have, as a patient, a right to privacy for all of your medical needs. Now, if you have a non-life-threatening injury, you have to get consent to treat, meaning if the person is conscious and there isn't an immediate threat to their life, you have to ask them permission before you treat them or give them any assistance. If there's a minor, so if somebody is under the age of 18, you have to get consent from their parent or their legal guardian. Again, if it's a non-life-threatening injury. If you have a life-threatening injury, somebody's choking or somebody is bleeding profusely, someone's potentially having a heart attack, you are allowed to bypass consent, because in the event of a life-threatening injury, it's a bigger priority to provide care than to get consent, because the time it may take to get, the person may not be able to provide it properly, or you may not, in the case of a minor, may not be able to get in touch with their parent or guardian in time for that to be something that's going to be beneficial. In all of our official athletic events for NAIA sports and for NCAA sports, you have to have either an athletic trainer, so ATC is an athletic trainer, or an other medical provider present. Now, this just means you have to have someone at the field. If, for example, you go and travel to an away game in California and our athletic trainer doesn't travel with you, the other team has to have one there. So somebody has to be present. It doesn't have to be someone for both sides. It just has to be at least one medical professional there. And their job is to provide any sort of essential first aid care or to implement an emergency action plan should it be needed. Now, there's two assessments that you're going to see. You have primary assessments and you have secondary assessments, or a primary survey and a secondary survey. The on-field assessment of a primary survey, this is when you have a life-threatening condition. So typically these are going to be seen in like collision sports such as like football mostly, but it's still not going to be limited to just that. So for example, if you have a major break in a bone, like I was showing you with the previous video, if you had a compound fracture, that's something that would be considered life-threatening. if you had a lightning strike, if you had someone that had a heart attack, or if you had someone that had a spinal cord injury, if you have somebody that has a major bleed, that's all considered life-threatening. So your primary survey is what you do as the on-field medical staff to go over or survey the field, making sure it's immediately safe for not only you, but for the person you're trying to assist, and also that they're not in a position where they are in a life-threatening circumstance. If they are, you immediately have to kick into your plan. But a primary survey is to rule out life-threatening conditions. A secondary survey is where you're going to assess the injury itself. Now, the person is going to have to be conscious for you to do a secondary survey. If they are unconscious, so if you go from this primary survey and it goes into the unconscious side, this is something where it is going to be a call 911 deal. If they are conscious, that's when you go into the secondary survey. So the secondary survey, it could be something as simple as, okay, I rolled my ankle and we just need to, make sure it's okay to get them to walk off the field, and then we can go do whatever. Initially, once they are considered to be stable enough for movement, you should get them off the field to then provide all of these different portions of it here, or different portions of the secondary survey. So a secondary survey is only conducted when you have a non-life-threatening or non-major accident or injury. So sprains, strains, cramps, things like that, those would all fall into the secondary survey. If you had a small cut or abrasion, say you scraped your knees kind of thing, those are all non-life threatening, something that you would give some sort of treatment for and then potentially get them back on the field. But primary survey means it's life threatening. Secondary survey means that the athlete is stable enough to not have to have immediate transport to a hospital or emergency room. When you get off the field, now is when you can get into a lot more different tests and much more in depth with the actual athlete themselves, because now you're in a controlled environment. When you're off the field, now you're talking about doing testing to really assess the injury. Perhaps you've gotten them a referral to a physician for evaluation and potential treatment. So now when you're off field, you're looking to actually address the injury in its full extent. You're not trying to just immediately stabilize the athlete to potentially get them back to play, or just to have them stable enough for transport. Now you're looking at a full assessment of them and how you can approach their overall signs and symptoms to better give yourself a good treatment plan, so that you can get that athlete back to return to play as quickly and safely as possible. Now, when you are talking about the initial treatment plans, originally you used to have this idea or this thing called PRICE, or some of it was shortened to RICE. But PRICE means it was prevention, rest, ice, compression, elevation. Now it's changed to POLICE. POLICE stands for protection, optimal loading, ice, compression, elevation. So first off, when you have an injury, you want to protect the injury. You want to make sure that the athlete is protected so you don't cause further injury. So for example, if someone has a suspected fractured leg, you don't want to make them walk on that leg. You want to splint or stabilize that leg somehow and make sure that they don't have to walk on it to prevent potential future injury or further injury there. Optimal loading is your weight-bearing status. This means how much weight can you put on the injured body part. If it's an ankle, can I stand on the ankle? If it's a leg, can I stand on the leg? If it's, my wrist or my arm, can I use that to move my body? That kind of thing. Icing, icing the area, pretty self-explanatory. Compression or wearing a compression wrap, these are typically going to be most appropriate if you hurt a limb. Now, you're really not going to be able to do a whole heck of a lot of compression to your torso or abdomen, but you'll typically see compression, either sleeves, arm socks, on the arms or the legs, especially if there's swelling present. And then elevation is much more important for the lower body than it is the upper body, because the lower body has a lot less blood flow to it, especially like the lower leg. So when you get below your knee, your blood flow becomes significantly reduced, and you need to really elevate to help with that venous blood return. So elevating an injured site is definitely going to help with reducing inflammation, and it helps to speed up the recovery process, especially with the lower leg. So as I was saying, with protection, you're protecting from further injury. With the optimal loading, you want to make sure that they're able to put weight on the appendage. So like I said, usually this is lower extremity. So LE stands for lower extremity, which is your legs. And you are going to measure this by the amount of weight they can put on that. So the easiest way to measure this is to say, if I had a right leg injury, I would be standing on my left leg and I would put my right leg on a scale. I would do this to see how much weight I can put on it, to see how essentially strong or stable that leg is. Now, in certain situations, such as like say right after surgery, you may be in a position of non-weight bearing status, or toe touch weight bearing, where it means you can't put your foot on the ground because you could potentially hurt yourself from the surgery. One example of this is if you have a meniscus repair. So if you tear your meniscus in your knee and you get that repaired, which means sewed back together, you're non-weight bearing for 4 weeks, meaning you can't, or you should not, be putting your foot on the ground while standing up at all for at least 4 weeks, or else you risk the possibility of compromising that surgical site. Ice you want to use as a method to help with reducing inflammation. In general, you want to ice something that's sore, you want to heat something that's stiff. Ice should always be done after an event. You don't want to ever ice prior to an event. The usual amount of time you would do for icing, general rule of thumb, is about 10 to 20 minutes, depending on the site and the severity. Research really is coming out, though, that says that ice isn't the best method to use, especially for injury recovery. What we're seeing now is that when you ice something, that you slow the blood flow to the area, which is a good idea to prevent further inflammation. However, because you're reducing blood flow to the area, you prevent the inflammation that's already there from getting out. So icing, if you do it in combination with, like, say, compression, could be good, but icing by itself is we're seeing more and more that it's not necessarily the best method or approach to be using for injury recovery. Now with compression, we are seeing this as being better than ice. With compression, what's happening here is that you're squeezing that injured area. So imagine if you had a stress ball and you squeeze it, like you squeeze it in your hand, that stress ball gets compressed, or it gets small in your hand, and it squirts out to the outsides of your hand. That's the same thing that happens when you have inflammation in a body part. If you squeeze or compress that injured area, it forces that inflammation out because there's not enough room for it. The quicker you're able to compress an area, the better your outcomes are. And if you're able to compress an area for at least 72 hours immediately after the injury, that gives you your best actual outcomes there. So you want to try to compress that area first over trying to ice it. And as we said with elevation, you're going to typically elevate your lower leg, but it's going to help with getting this venous return. So that's your blood return. Venous refers to your veins. Return means return to the heart. You have very compromised or very low blood flow in your lower leg. So you want to have a elevation to help assist, like have a gravity assisting that blood flow back to you. If you're standing up, you have to work against gravity, which makes it even more difficult for that injury to really heal. So if you're laying down with the leg elevated here, now you use gravity to your favor, which makes that inflammation get out of there a lot quicker. So that is your quick overview here of Chapter 8. So that gives you your basic overview of handling emergency situations and the initial rehabilitative things you would need to do for that. I'll be following up here with a few more videos to finish out the rest of Unit 5, and then we will move on from there. So until next time, I'll see you all later.